Did you know that more men desire a bigger penis than those who actually wish they were taller? I'm Dr. Sarah Williams. Today, we're going to have a very open and honest conversation about something a lot of men wonder about, but don't always feel comfortable bringing up. And that's penile girth enhancement. Studies show that more men wish they had a bigger penis than men who wish they were taller. In fact, in one large study of over 26,000 men, 45% said they wanted a larger penis, while only 38% said they wanted to be taller. That shows us just how important this topic is for many men and how deeply it ties into self-image and confidence. What's really interesting is that most men who seek enhancement are already within normal size ranges. They're not actually small from a medical standpoint, but they often overestimate what normal really is. For example, when asked about flaccid size, some men guessed that the average was around 13 centimeters, when in reality the actual average is closer to 8 to 10. Because of this, nearly 9 out of 10 men end up believing their penis is too short or too thin, even though that's not true at all. Sometimes people assume that this desire for enhancement must always be related to body dysmorphia, a condition where someone fixates on a perceived flaw. And while that can be true for some, the numbers show that only about 10 to 15% of men seeking enlargement fall into that category. For those men, the distress can be intense, leading them to avoid intimacy, locker rooms, or even romantic relationships. But for the majority, the reasons are different. They may want to feel more confident. They may want their penis to look more proportional to their body. They may want to please their partner more effectively, or they may simply be struggling with comparisons to others. I want to say something clearly here. Your self-worth as a man is not defined by a ruler. But I also understand that reassurance and therapy don't always erase the concern. Some men do the inner work and still struggle. For those cases, enhancement may be an option, but only when there's solid evidence that the method is safe and effective. So let's look at what's out there. First, let's clear up a common myth. Pills, powders, or gummies you see online don't work. There is no FDA-approved oral supplement that increases penis size. Many of these products are unsafe, containing hidden ingredients, and yet the industry is enormous, expected to reach nearly $600 billion by 2025. If a safe, effective pill really existed, every doctor would prescribe it. Now let's talk about treatments that have been studied. Vacuum erection devices are often used for erectile dysfunction, but some try them for enlargement. They do pull blood into the penis, temporarily increasing size, but once removed, things return to normal. Long-term studies show no lasting change, and satisfaction rates are low. Penile traction devices, which work like braces by applying continuous tension, can create modest improvements in length after months of daily use, but they do very little for girth. Injections are another category. Fat injections involve harvesting fat from the abdomen or thighs and injecting it under the penile skin. Some men do gain 2 to 3 centimeters in girth, but complications like lumps, scarring, irregular shapes, and even rare but dangerous fat embolisms have been reported. Silicone injections have been tried as well, but they're linked to severe swelling, granulomas, distortion, and long-term dysfunction, making them unsafe. Fillers are more popular today. Hyaluronic acid, the same filler used in lips and faces, can provide a temporary boost of 2 to 3 centimeters, though sensation can decrease and results fade over time. Another filler, PMMA, is permanent, but often leads to nodules, ridges, and complications that are extremely difficult to fix. Surgery is the most invasive option and comes with the highest complication rates. Grafts, which use tissue from the body or from animals, can increase girth by a couple of centimeters, but issues like fibrosis, pain, and even penile shortening are common. The Penile implant, a silicone sleeve designed specifically for enlargement, showed promising results at first, but reports of complications and revision surgeries have been increasing. The most radical option, corporal augmentation phalloplasty, uses vein grafts sewn onto erectile tissue. A handful of men have undergone this, with some increase in girth during erections, but the risks include pain, scarring, and curvature. So what's the bottom line? There is currently no universally accepted, gold standard method for penile girth enhancement. Every option comes with trade-offs, whether it's temporary results, significant risks, or both. That doesn't mean enhancement is impossible, but it does mean that if you're considering it, the decision should be made very carefully, with realistic expectations and professional guidance. And here's something important. Many complications are underreported because men don't always return to the surgeon who performed the procedure. They quietly seek help elsewhere. So when you read about complication rates, remember, they may not tell the full story. Now let's take a step back. Why does this matter so much to men? Because for many, size is tied directly to confidence, masculinity, and identity. Some men believe their worth as a partner depends on size. And while size can play some role in sexual satisfaction, the truth is that intimacy, communication, foreplay, and emotional connection play an even bigger role in a fulfilling sex life. So my message is this. If you're feeling insecure, you're not alone. If you're considering enhancement, do your research and speak with a qualified physician. And if you decide not to pursue it, know this. Your value as a man does not depend on the size of your genitals. Penile girth enhancement is an area filled with hype and misinformation. Some methods do provide modest results, but none are perfect, and all carry risks. If you're thinking about it, ask yourself if you're making the decision for yourself and whether you truly understand the risks. I'm Dr. Sarah Williams, and I'll leave you with this. Take care of your body, take care of your confidence, and always remember, you are more than a measurement. Kindly subscribe, like, and share if you find this topic interesting and want me to research on more helpful topics. Comment your opinion below.